All right, so I think quite a few people are here already. A few are still coming in, but I think we can get started. So as you know, this call is being recorded, you just heard it, and I'll give the floor to Katie to launch your presentation.
Thanks, Quentin. Welcome, everyone. And thank you to some of our speakers for joining us early. We really appreciate it. Here we are. Today, we're excited to launch the GFAN Civil Society Ask for the 7th replenishment. Some of you, we've shared this over the GFAN listserv last week under embargo, and you can feel free to press send on anything that you've been waiting to do until now. And I just wanted to say that in this call, which I think we've got an agenda on the next slide, if you're able to sort of put us through to that, is that we hope to just provide you with a quick overview of the document and the tools that are available. And then we have Linda Mafu from the Global Fund Secretariat joining us to provide some quick remarks about the GFAN paper. And then we have a small panel with Matt Kavanagh from UNAIDS and Juan Quat from Vietnam. And we're going to be just talking about some of the general themes that are related to the work that we talk about in the GFAN report. We want to make sure that we leave you with, at the end of this call, with a sense of what some of the next steps are for us here at GFAN, so that we can make sure that you know some of the other resources that are coming. But that is the agenda for today. Hopefully we have lots of times for some Q&A and discussion throughout. But of course, as always, this is just the first opportunity for these conversations. For some of you, it's even the second and third opportunity to have a conversation about this paper already. But for others, it is the first chance as we're finally able to share it publicly. So Quentin, can you put us to my new favorite slide next? See if this actually works in a COVID world. For the 7th replenishment, we need $28.5 billion. There it is. It is my absolutely new favorite GIF. I will use it too much on Twitter and Facebook. You're welcome. And we encourage all of you to do it as well. It's in the social media pack, along with a bunch of other resources that Quentin will talk about later. So without further ado, that is our ask, $28.5 billion for the Global Fund. Quentin, if we could go to the next slide. I just wanted to run us through just some of the highlights about, what this report and what this ask is. I think that in this paper, it's a fairly short paper. Our ask is quite clear that we need bold and decisive action now. The Global Fund is an existing funding mechanism with a proven track record. It is a key instrument in strengthening global health, which is pandemic preparedness. So while it is not the only funding mechanism or initiative that merits serious attention and financial support, it is a key way to invest in country-led programs fighting against the 3 diseases and in pandemic preparedness, which is everybody's favorite buzzword these days. Like so many other things, COVID has set us backwards, but it has also shown us that global level cooperation and investments are both possible and are essential to help countries rapidly identify and contain disease outbreaks and respond to, mitigate, and prevent the spread of pandemics whenever and wherever they occur. We need to invest in the 3 diseases and the community-led and community-based systems for health that are critical to really being able to respond to pandemics. In our report, we have also tried to be clear that money matters, that this is about a clear expression of what is needed, not what is politically feasible or what can be accomplished through portfolio optimization, savings, or innovation. These are all important as well, but cannot be the lion's share of the increase that we know we need to do to get back on track. As someone who has been actively supporting community and civil society reps in the World Health Organization's ACT Day platform, the level of ground-up engagement of lower and middle-income countries and communities and civil society in these kinds of decisions is absolutely abysmal. The Global Fund is possibly one among several exceptions where we do this a little bit better. So while things like C19RM are imperfect, they are blunt, and they were rushed, but it is still the largest grants fund for responding to COVID-19 that isn't about determinations being made in Geneva or Washington or other donor capitals, but that have been country-led and that has allowed countries to determine what investments they needed at that time or at this time to respond to COVID. And that has been key and central to the way the Global Fund has operated for 20 years to respond to HIV, AIDS, TB, and malaria. But the key to me from this report that I hope you can take away with you is to get more money into the hands of countries themselves in the form of grants, not loans. As we know, countries are already facing record levels of indebtedness that's going to challenge the ability of countries to meet the SDGs more broadly and the health challenges of the next few years in the period that we're talking about for the Global Fund's replenishment. And we believe from GFAN that it is preferable that this money is reached through mechanisms where communities and CSOs have a right and there is an expectation that they be engaged, which is something that the Global Fund has also been imperfect in, but at least has an objective and stated principle with long-standing mechanisms and processes to accomplish that. On the next slide, we've shared the table that contains the breakdown of the actual financial ask that we have made. This is also contained in the report. We get a little bit fearful at GFAN about tables because sometimes we make mistakes on numbers. So hopefully we've gotten it right this time. We've looked at it a few hundred times, I would say, but our methodology has been quite simple in determining this ask. Historically speaking, the Global Fund has contributed a certain proportion or percentage of overall funding for each of the 3 diseases in eligible countries. Our numbers here are simply a blunt fair share based on the historical proportion the Global Fund has funded applied to the updated resource estimates needs for the 3 diseases. The details and the numbers, just FYI, in the report are contained in the footnotes if you want to sort of read into the specifics and the sources for it. The last investment case from the Global Fund asked for $14 billion, whereas GFAN had pitched for an $18 billion investment. There was then, as there will be now, I am sure, questions about the difference between the number that we are putting out there and the number that we expect the Global Fund will put out through its investment case, which is likely to be lower than $28.5 billion. The answer, though, to explain this difference is quite simple. Unlike the 6th replenishment investment case from the Secretariat, which made a pitch for 82% of funding that could be attributed to the Global Fund in its $14 billion ask, GFAN asked for the full amount and even some small increases. We didn't then, and we don't now in this report, provide a discount on what is needed to fund the end of the 3 diseases. If UNAIDS, for example, says $X billion is needed in Global Fund eligible countries, and the Global Fund has traditionally contributed close to 50% of that of available funding in Global Fund eligible countries, that is what we are asking for. All 3 technical partners have adjusted their resource estimates upwards recently, rather significantly, and that is why GFAN's numbers are also significantly higher than they were in our ask for the 6th replenishment. Can I have the next slide, Conte? In addition to that sort of basic methodology for the 3 diseases, which is the same that we used in the 6th replenishment, we are also asking for $4.5 billion over 3 years to strengthen community-led and community-based systems. I'll just take a quick step back to try and explain this a bit better. It has been difficult to position the GFAN ask amidst the uncertainty and unknown factors that we sort of face right now in global health and global health financing. I was really grateful for the advice of a small group of temporary interim advisory group members composed of GFAN members who joined us through July, August, September to review some of these numbers and some of the big themes that we are trying to deal with. And it was challenging. Some of the factors that we just don't have a solid sense of at the moment includes what levels of domestic resource mobilization, including co-payments, are realistic in the upcoming period. How will increasing debt levels affect countries in the more immediate term? How will the future international consensus on pandemic preparedness and response evolve? And within that, what is the role for the Global Fund? The Global Fund has handed over to country-led initiatives more funding via C19RM, but it has not necessarily been sufficient to even respond to COVID, as we all know. So in trying to come up with this ask, we noted that there is a growing recognition and for some resignation that the Global Fund does have a unique role to play in the COVID world in which we find ourselves, both in continuing to address COVID in many of the countries it operates in, as well as in conversations at various levels on future pandemic preparedness. And we didn't want to come up with an ask that ignored the fact that if the Global Fund is expected to do more than what it has been doing in the past around AIDS, TB, and malaria, we didn't want to come up with an ask that didn't put a dollar figure on that. And so this portion of the ask around strengthening community-led responses is meant to respond to what we've heard through the strategy conversations about the need to increase that particular component of the RSSH funding with the Global Fund, and that it's not per se a request for a separate modality, but an acknowledgement that there will be more money that is needed if the Global Fund is to take on another role within sort of the global health architecture, if you want to use that word, or ecology. The foundation of the Global Fund was built on community mobilization, on activism, and a sense that we were doing it wrong and that we were doing it unequally. And I think that if anything, we have seen that these issues remain in the way that we address global health over the last few years. And so putting a strong ask around community-led, community-based system strengthening, we felt was a way to address the core values of the Global Fund and the values and the practice that we would like to see improved and increased, I guess, is a good way to say it. And also just to say that the 4.5 billion that we've called for in community-led responses is roughly equivalent to what the Global Fund has managed above and beyond its country allocations to both mobilize resources and actually push out the door over the last sort of 16 months. So that is our ask. In a nutshell, that is the rationale behind it. I'm going to pass it over to my colleague Quentin to tell you a little bit more about what some of the next steps are and where some of the resources can be found. And then we're going to come back to our panelists and we're going to have a bit of a discussion and Q&A. But so first to Quentin, then key questions to all of you, and then to our panel. So Quentin.
Thank you, Katie. Hi, everyone. So I just put in the chat two links. The first one is a link to the full report. And so we, as of today, there are translations in 4 languages. So there's English, French, Spanish, Russian, and Arabic. And we'll have an Hindi translation coming up in a few days. Alongside that, we're also releasing the social media kit, and the link is also in the chat. You have received 50 emails from me over the past week pointing that out. The reason is that it's been the last time around, so the last report, I wasn't around, but I heard the stories, and it was easier to create a buzz around it because we're able to use the fact that we're meeting people face to face and could, talk around coffee breaks at conference, pass on flyers, we had a little drum and we could ring it. And it's a lot harder this time around because, of course, we've not been in face to face with anyone, and we've had to do it entirely virtually. So we've tried to address this in 2 ways. The first one is, all that noise I've been making about the social media kit and the importance of being present on all of those platforms. Not so much because we're trying to go viral, but just to make sure that the right people see this appearing in the social media often enough, that eventually anchors the expectation, because it's really what we're trying to do here to set the standard high for the investment case. And the other approach we've been taking is that staggered release. So the full report is now out, and we'll have a series of briefs coming up throughout Q1 2022 and further. So we have consulted the membership particularly during the annual meeting. We'll have briefs coming out for each of the 3 diseases. We'll have one around beyond ODA, so alternative sources of financing, because we realize that the ask we put forward is high, and ODA might not be enough to meet it. We'll also have a brief on harm reduction and another brief on PPR. And so the idea is that each of these pieces is going to be able to both dive deep into important issues that we might not have had space to really engage with in a single report. And at the same time, they will be short enough that it will be easily digestible. Following that same philosophy, a lot of the visuals you will find in the social media kit are really really putting the emphasis on the dollar amount of the money, because we think that money matters. And we really hope that people don't have to read through full report to get an idea of what our ask is. So that's it. I really encourage, of course, all of you to read the report and to check out the social media kit, translated in French as well. And with this, I give the floor back to Katie.
Thanks, Conte. And before we go to any questions that you might have around the report, I would like to invite the Global Fund Secretariat. I would like to invite Linda Mafu, who's joined us from the Secretariat, to provide some short remarks in response to our publication of the paper today, or our launch of the paper today, not publication. Linda?
Thank you so much. I'm so excited. Thank you for inviting us to make short remarks. But I'm really excited about the number, about the fact that we are rallying everyone, all the global leaders, we are rallying the communities behind a number that is going to ensure that we save lives, that is going to ensure that people are able to access treatment, they are able to access services without experiencing financial hardship, because that is what the Global Fund is about. The Global Fund is about ensuring that people are accessing services, people are able to live their life, to thrive, without feeling that if I'm poor in Lusikisiki, I can't afford treatment, therefore I'm doomed. So thank you so much for that. I would like to say congratulations to GFAN, to the reference group for such excellent work, for us to land at 28.5 billion. Oh, wow. It means that it's going to be a long walk to freedom, a lot of advocacy, a lot of campaigning, a lot of tie-ins to ensure that we get to a point where we have these resources. This is very important for the Global Fund. Of course, this is a civil society ask. This is a civil society call to action for global leaders. The Global Fund therefore expresses its appreciation for the support, for the advocacy, for the reminder and ensuring that HIV, TB, and malaria remains high on the agenda. There's also resources to invest in HIV, TB, and malaria. That is very important for us. So congratulations on this. Of course, it means a lot of work, hard work, and the Global Fund currently is working on its investment case, and that will be shared particularly in the first quarter of 2022, because we are going to have a preparatory meeting. Of course, we will be aligned in our messaging, we will be aligned in our advocacy, and we will find ways of making sure that we understand each other's ask, each other's number. So we look forward to that. And again, thank you so much for your support. Thank you for the advocacy and ensuring that we keep on ensuring that there are resources for HIV, TB, and malaria, because that's our core business. And we are about saving people's lives. And behind each and every number that we have, there's a human face. There's me behind that. There's Zoleka somewhere. So it is about humanity. And thank you so much for bringing that back and bringing us back on track. Thank you so much.
Thank you, Linda. Really appreciate your enthusiasm and support. And it's been a great process this time in developing our ask to have many, back and forth and lots of collaboration in terms of, figuring out how we do this together. So thank you very much for that. Really appreciate those comments. And if anybody didn't notice yet, the title of the report is the world's longest title for a report, but we found ourselves wanting to make sure that we situated this conversation in exactly what we wanted to say, which is we need to fully fund the Global Fund. We need to get back on track to end the 3 diseases, and we need to do that in what we're calling a COVID world. So thank you, Linda. Really appreciate that. Opening it up to the floor. Oh, sorry, go ahead, Linda.
Because I'm in Cape Town, I'm in South Africa, I'm going to say Amanda.
Where to?
Yes.
Thanks, Linda.
Thanks, Linda. Thank you. I really wish we weren't all on yet another Zoom call for this, because it would be more fun. So thank you, appreciate it. And I would just go to everyone if there are any questions around the report before we go to our panelists. I'm happy to take questions now. We will have more time at the end for more discussion, but if there's questions about the report or any of the resources that we shared, quick raise your hand, that would be helpful. Or pop it into the chat. Any quick questions at this stage around the report? Perfect. I really like silence at this point in time on the call. But as I said, this is not the last, it is just the first opportunity. There is a question in the chat about work to break down the total 28.5 billion into donor specific asks. I think that we will get there, Lee. I think that that work will be led primarily by advocates in different countries who we will be working with to identify opportunities to talk both about this report, but more broadly about replenishment. I don't believe that at this stage I'm thinking that it will be effective for us to take on a global process of determining a fair share ask and going about it that way. But I'm always open to that suggestion. It is something we have done in the past and it is at times successful. But normally how we have approached replenishment, not normally, I guess, in the last two replenishments, the way that we have approached it is by advocates within countries identifying an ask that's based on their assessment of the sources of funding and the asks that are in both the GFAN ask as well as that will come out in the investment case. So open to the idea of fair share assessments if people feel that that would be useful in their advocacy. But at this moment, that is not something specific that we have planned. And so thank you for the question, Lee. Any other questions? Not seeing any in the chat or anybody trying to unmute or raise their hand. I think we're just going to go ahead to our panel, which I'm really excited about and really grateful and happy to be able to welcome for all of you two panelists. Conte, maybe we can put up the next slide that has pictures and quick bios of both of them. So really excited to have Wan Quat with us, who's the Executive Director of SCDI. And as you can read in her bio, she's a longtime friend and active in so many different spaces that we all know well, including our regional partner, GFAN Asia Pacific. And we are also joined by Matt Kavanaugh, who's a special advisor at UNAIDS, and we're excited to have you here, Matt. It has been maybe some time since you've been on a GFAN call, but we'll welcome you here and really excited to hear about sort of your perspectives on this report that we have shared. It's important to us to say that, we have only, I'm not sure actually if we didn't just lose Matt. No, then we found him. Sorry. My mistake. So the panel is a simple panel. I'm going to pass it over to each of them to provide some overarching remarks about the paper and the ask that we have put forward as GFAN. And then we just have a couple questions and a short discussion with the panelists around those, and then put it back to all of you for any Q&A and discussion that we could have. So, and my colleagues Tara and Conte are popping into the chat at different points in time links to all of the report, which is available in a number of languages, as Conte said, and the resources. So just have a look in the chat if you haven't seen it yet. We'll be popping it in there a few times over the course of the call. So I'd like to pass it over to Wan Quat, and I was just wondering if you would first share just some of your overall reflections on the report today, and then Matt, the same from you, and then we'll proceed to questions for you both.
Yeah, thank you, Katie, and good evening, everyone. It's 9:30 p.m. in Hanoi, so lovely to spend the evening with you. Just like to get on through those and ask those report of GFAN to try to get back on track. I just want to share with you some perspective from Asia Pacific, and as a person working on the ground, connecting to the community, we provide service for people, the key population in Vietnam for HIV, TB, and malaria, and we was in the middle of the COVID COVID-19 pandemic in the country as well. So I just want to share with you some perspective from both a local organization, but also as the chair of GFAN AP. So just to remind us some of the old problem, old issue that we've been facing over and over again. The number one is that we have made quite a bit of progress, but we are not really on track to achieve target for the 3 disease or the universal health coverage. So in 2019, for example, in Asia Pacific, only 75% of people living with HIV here know their status. So we are still, and you know that the last mile, the miles are more difficult to reach. So we are still quite far from the 90 target. Similar situation for TB or malaria. And that is where we are in terms of achieving the target, but the funding is insufficient. So we don't have there's a lot of priority for Africa, for example. So Asia is on way like not the priority for the global fund funding. We are short of on the target in terms of the funding for the 3 disease. I mean globally, but also in Asia Pacific. And in terms of healthcare in general, this region is still see a very high and increasing our pocket expenditure. And the people who are left behind, the vulnerable population are left further behind in terms of accessing to healthcare. So in Asia Pacific, Global Fund play a very important role. But as I mentioned before, it's only the Global Fund have only invested around 16 of the total contribution in the Asia Pacific. So globally 100%, Asia Pacific 16%. That is important because it put 2.5 million people on ART and treat 3.1 million people with TB and distribute nearly 10 million mosquito net. But looking at the need of the region is still far from enough. And we all know that to improve access to healthcare by vulnerable and marginalized community, we need to address systemic barrier, human right barrier, and socio-economic barrier. And many Asia Pacific countries still have law and policies that criminalize or disadvantage some key population. In particularly sex worker, people who use drugs, or the rise of LGBTIQ people are not well recognized in this region. And to make those, it doesn't help when the domestic financing for the 3 disease or the investment in the vulnerable and marginalized group still lacking. Our government in this region are not, except for 1 or 2 countries, most of the government in this region are not really enthusiastic about investing on HIV, TB, malaria, and in particularly not investing in for the community system strengthening or investing in the marginalized and key population or the right-based approach. So that is like the old problem. Every year we can say it over and over again. I just repeat it. But what happened in the next 2 years is the COVID pandemic, and it makes the situation much worse for all the 3 diseases. HIV, TB, malaria is interrupt treatment. It takes away the limited health resources, the health on the healthcare worker, and the health facility are mobilized to respond to the COVID, leaving people with HIV, TB, and people as vulnerable to malaria outside of the system, we have witnessed so many people who experience treatment interruption or not having access to essential services for HIV. And then there's you can see an increase of human rights problem, the abuse of emergency power by different level of authority, and the general human rights problem, in particularly with our population. It increased poverty. In general poverty, but in particularly the people who are most affected by HIV, TB, malaria, sex workers, people who use drugs, people who are vulnerable to TB, people who are vulnerable to malaria, they become even pushed further in the poverty and make themselves more vulnerable. And then the gender gap is worsened, gender-based violence and other violence increase, particularly for the population that we care about, LGBT, for example, or sex worker. And then the mental health, the key population that we care about, normally before the COVID have already suffered a much higher burden of mental health than the general population, and COVID make it worse. So the task in front of us is paramount. If every other replenishment, we said we have a huge job to do. Now the job is double, triple, 400 times than that. So we really need the donor to invest more and invest now for a successful resources global fund, because it is I'm not talking about this because I am in a GFAN meeting. I'm talking as a doctor who live in the country, seeing people going through the HIV, TB, COVID, and other health needs. And I see that the system that the Global Fund have to build is really effective in response to it. The Global Fund was quick. Like in Vietnam, the Global Fund is still the largest donor for COVID so far because of the system and the mechanism that has been put in place. So we need to invest more in the Global Fund, invest earlier, timely to the Global Fund, so that the Global Fund will have to keep the progress on HIV, TB, malaria, to mitigate the impact of COVID on these three diseases, but also, and very importantly, to have to build a resilient systems. And here I use a plural system with an S, the health system and the community system that are resilient and can help to respond not only to three diseases but other health threats. And I just want to emphasize the importance of the community system. I have witnessed with my own eyes and my own experience of how the community system help the key population and people living with HIV or people having TB to mitigate the impact of COVID. People share the ARV, people help under the lockdown, the people under the lockdown or under quarantine to have access to the treatment, etc. So without the community system, the situation for HIV, TB, and malaria would be much worse, at least in my country that I have seen. And the community system also help to mitigate other impact of COVID, like to provide food, for example, or help people going through the hardship, like having to share to help them to pay rent so that they don't need to they are not kicked out on the street. So that is the community system is really important. And the other things that the donor and the Global Fund, I hope that we do in the next couple of years, continue to do and do more, is to protect human rights. In the COVID response is an excuse for a lot of violation of human rights everywhere in the world. And I think and our key population are the one who suffer even more than the general population. So it's the time now to push further for the to push that back and to protect human rights. And then the COVID response also showed that when the government need money, they could mobilize it. And so domestic resources there, and the government and the population can mobilize domestic resources when they think it's important for the three disease, but also to build the community system and protect human rights. So I stop here and just want to join the call again to invest more on the global fund. 28.5 is the number that we aim for, not a politically correct number, not a politically probably not a politically feasible number, but it's a number that we think that at least we need in order to address this issue. So thank you very much.
Thank you. Thank you, Juan Quat. It's really helpful to hear from you, and it's always great to hear the experience that you have on the ground, and watching what you have been doing over the last year and a half, and supporting the communities that you serve and that you work with is just always really helpful to bring that back to these conversations globally. And you point out a number of really important issues, which is that it is these community systems that have had to pivot and have had to find ways to support each other and to support community members, and that while not necessarily politically correct in terms of an ask, this is an ask that will that should resonate, and that we know that when there's a need for the money can be found. That's what the last year and a half has shown us. IHME, has reported, a really significant jump in health expenditures globally over the last year and a half. And we know that there are disparities in that, but when the money is needed, it can be founded. So that's really helpful. Thank you so much for those remarks. I'm hoping that Matt is back with us and not having challenges with some construction site near his house that he said had just sort of started up operations. But Matt, I wanted to pass it over to you for some of your general remarks in response to the paper's launch today. So Matt.
No, great. And thanks for having me, and apologies. I've just had to change locations in my house to try to go find a place that was not full of construction. They decided that outside my window, this was a perfect time to begin jackhammering. So it is that COVID world. So let me say a few things on behalf of UNAIDS and also on just behalf of folks who care about the fight against AIDS worldwide. This is incredibly welcome. Thank you to GFAN. It's been a while since I've been on a GFAN call, but indeed, this is just incredibly critical work. It is really nice to see a bold, powerful ask. It's great to see Linda on behalf of the Global Fund cheering on this push that says, as was said previously, that we're not actually going to presume that finding the money is impossible. We're not actually going to assume that we can't actually do what we need. So a few thoughts. One, and you'll hear more from us in the next 10 days around World AIDS Day as we launch a big new report next Monday, and as we roll into UNAIDS or into World AIDS Day. AIDS remains a pandemic, and this is the kind of thinking that is going to help us get that pandemic under control. We see across the world, countries are doing what was said to be impossible, right? We've got countries like tiny little Swaziland that has actually managed to reach 95% of people that know their status, 95% of those on treatment, and 95% of those virally suppressed, right? This is what you do when you have a pandemic with no cure and no vaccine. And so there are countries from Swaziland to Switzerland that have figured out how to do this, right? And yet, overall, if we look globally, infections are far off track, right? If we continue on the pace that we are currently on, we could see some countries stretch for decades in ending the AIDS pandemic. And make no mistake, it is a pandemic, right? And so we have to address those inequalities that are driving the AIDS pandemic, but also that are driving multiple other pandemics, right? We see that we're not bending the curves fast enough on HIV. We're also not bending the curves fast enough on COVID-19. We're also clearly seeing an uptick in deaths from TB. And so as we think about these things, these are driven by the inequalities at the heart of the pandemic. Just to say a few things on that, the damage done to HIV programs during COVID-19, it's varied across countries, but in many places it's been really severe. Harm reduction services, for example, were disrupted in 2/3 of the 130 countries that we surveyed. The pace of testing declined in 40 out of 50 countries that reported to UNAIDS this year. The number of people starting ARV treatment was up just 1.9% when we would usually expect it to be up 6%, and if we just draw a straight line. So the disruptions have been really substantial. But the good news, I think, is that we do have a plan, right? The global AIDS strategy, it was passed by the UN General Assembly. Member states, with a tiny few exceptions, all signed on to doing it. And the global AIDS strategy says we're going to do the hardest work, right? But it does include key things that are essential, not just to end AIDS, but also to respond to COVID-19. And to be truly prepared for the pandemics to come. Now, I'm not talking about the idea that somehow we should be expecting the Global Fund to carry everything when it comes to pandemic response. But we know that there are things that we need to end AIDS, to stop TB, to stop malaria, to have these pandemics of today disappear. Those same things are going to help us stop COVID-19. They are going to be what's critical to whether or not we are prepared for the pandemics to come. And those are things like community-led and community-based infrastructure. I was thrilled to see that in the GFAN report, right? It's a key piece of what we need. Where communities have been able to respond to COVID-19 because they are well-financed, they have organized groups that are working alongside public health actors. What we've seen is trust. What we've seen is health services that are actually able to get to the most marginalized, including the key populations that were just talked about. This is key work. We also need work to make medicines more affordable and available, right? The crisis of COVID-19 vaccine access is very real. Human rights efforts have to be funded, right? This idea that somehow there's a tension between public health and human rights has reemerged under COVID-19. It is reemerging under HIV, but we have learned that is actually a failure to think about it. So I'll just conclude by saying, look, if we look at the world as a whole, we can see very clearly what success looks like. We know the key ingredients, but the hardest work is actually ahead, right? The hardest work on AIDS, TB, malaria, it's not the cheapest work. The cheapest work, frankly, has already been done, right? It's the hardest work that's ahead. And that's the work that we're not doing fast enough. UNCTAD estimated the other day that we were roughly going to take a $4 trillion hit at minimum to the global economy in the very short term, right? $4 trillion. So if that's the global hit that we're talking about, we need to stop and break out of the thinking where what we can do is we can break off a little tiny bit of ODA, we can kind of move little bits here and there. And instead, let's imagine the world in which we have actually built the pandemic preparedness that ends AIDS and that also helps us prepare for the future. I think that's what this ask starts to do, and I think it's incredibly important. So thank you to GFAN for moving ahead. Over to you, Katie.
Yeah, thanks, Matt. That's really helpful. I think, I think that part that you were saying about how the hardest work is still ahead of us, and it's not necessarily the cheapest work. It really goes back to, we talk a lot about whether we can reach those that are hard to reach. And we've had surprisingly short arms in our attempts to reach, some of the places, and where interventions are really needed. And we're seeing that now, in the COVID response as well, even in places where there are strong, where there is a strong response, those tend to be in urban, better off kind of settings, and in settings where, large employers are supportive and are actively engaged, right? But for the rural, for people who are not engaged in the formal economy, et cetera, that is where we're seeing, that the very short arms of the COVID response globally is really leaving even more people behind. And that's true. And that's part of, and that's been part of what we've talked about. In GFAN, we've been talking for a few years, Matt, and it's been a while, as you said, since you've been on a GFAN call necessarily, but we've been talking a lot about this idea of needing to get beyond ODA. And we've been talking about this for a few years, and there's some work around global public investment that we've been sort of a part of over the years that's been headed by Jonathan Glennie, who's attended a few GFAN meetings. And I was just wondering if you could expand a little bit more. You're a resource mobilization advocate at heart, or at least that's how we met anyways, many years ago. So I'm just wondering how how you think that this is feasible. Like, what is possible? How do we talk to donors about this? How do we talk to them about what we mean when we say beyond ODA? What are some of those other sort of sources of financing or places that we should be going after?
So I think this is really interesting, right? And you'll not be surprised to think that to hear that I think you're right, that there's a whole new world thing about it. I think two things to put in mind. One, we are at this moment of global economic crisis that is driven by a global pandemic, right? And so this reality does change the political calculus, I think, in countries around the world, for better or for worse, right? It's worth noting, and this was, I think, said early on, that countries that are most affected by HIV, by TB, by malaria, they are also now facing really huge hurdles when it comes to debt. They have treasuries that are empty and emergency payments that have had to balloon. And so we really are in a kind of fiscal crisis moment. But it's also a moment that that the world has the opportunity to rethink how it finances these big picture questions, right? And so to me, one way to think about it is a kind of very narrow response that we've seen from some governments and from some places, that there's a kind of very narrow global health security interest, that it's only about kind of keeping the diseases of the poor away from the rich, right? And that's one way to think about it. But it's, I think, the wrong way to think about it, right? There is another alternative which says, if we're going to think about what it actually takes to keep the well-being and health of our citizens in any given rich country, let's take into account what that global cost actually is, right? And COVID-19 should be the clearest wake-up call that actually, where you have deep entrenched inequalities around the world that drive viruses, that is a bad strategy, that you can't actually put up walls. I'm talking to you from Washington, D.C., where we quite literally, during the previous administration, tried to put up walls in order to keep the COVID virus out. The goal was like, we can somehow do this. And it failed on an epic scale. And then we tried to respond by only vaccinating certain, prioritizing vaccinations for the United States. And that has also failed, as indicated by the variants that have come and as indicated by the walls that are going up. So if that is true, then let's think about health budgets. Let's think about defense budgets. Let's think about other mechanisms, like, for example, special drawing rights at the IMF. Let's think about debt restructuring, that all is able to free up big amounts of money, right? In which $28 billion becomes, kind of a rounding error, frankly, right? When we start talking in trillions, because that's actually what's needed for the kind of delivery of global public goods from all of the different mechanisms that exist, then we're in a very different place. Nobody funded their COVID-19 response out of their ODA budgets, right? When there was money that was needed for building vaccines, for buying them, for getting them out there, for doing the R&D, et cetera, that money did not come from ODA. And so where we allow kind of our thinking on pandemics to only exist within ODA, we're misunderstanding the global pot that's out there. And I think that does create an opportunity for advocates to say, let's rethink this. Let's think about a bigger, bolder way to finance these things. Let's get the multilateral development banks involved. Let's get the IMF involved. Let's get all of the kind of players involved in order to have sufficient resources. So that's my kind of answer to that question. I think it's a key one and the right one.
Yeah, and I really like how you frame that in terms of, that none of this was funded. Responses weren't funded through ODA. They weren't even funded through national health budgets, right? In countries like mine or yours, the responses that we've had were funded out of extraordinary measures and just the willingness and the need to find, additional mechanisms. And so, Juan, if I could just come back to you just to close us off a little bit, just thinking about some of that and that, like, the centering of communities and community-led investments. How do we make sure that is what we were doing? Is the Global Fund well placed to do that now? Are there ways in which you'd like to see the investment case from the Global Fund be clear about community-led investments, for example, or our replenishment advocacy being clear about community-led investments, our community-led work and investments being done? So I'm just wondering if we could just pass it to you just to finish us off in terms of the panel, and then we'll go to everyone to see if there's any questions or other discussion points that folks wanted to raise.
Yeah, so I come from Vietnam, and we our first president, the founding president Ho Chi Minh, have a say, it's famous until today, that for the easiest thing, without the population, you won't do it. For the most difficult things, if you have a population with you, you won't do it. So in our history, it's like that. When the population are mobilized, we overcome the war, we overcome the challenge, the biggest challenge of many times in our history. So that speaks to the importance of the population, of the community, once it is organized. So if we can organize the community, we can overcome many things. We talk about advocacy, we talk about human rights. And what I have learned is that whatever go from the top down, it can have a very short life. The government change, right? Today you have President, 4 years ago we have a President Trump, and now you have a Biden, and the government change, the people stay. The investment in the community is the most sustainable, the longest lasting investment. People are there, always there. The knowledge are there. If you can have to organize, to have the community to organize, to get capacitated, is there. Before COVID, during COVID, after COVID, and if we that is the most lasting investment. So if you want to, if the global fund and the donor is smart enough, then the community system strengthening need to be seriously considered and invested. It should not be just a lip service. It should not be just a token, just to tick the box that, okay, we put like a $20,000 or 1% of the funding for what they call the community activity. That's not serious. That's not sincere. That's a tokenism. So we see that during COVID, without the community, we would have go back many years in terms of HIV, TB, and malaria. But now, I hope that everybody now with the COVID could see that how important the community system is. The community is there, but we need to invest in order to build a system here, including the knowledge, the information, the organization, the structure, so that we can work together, so that when the time we need, we can mobilize. And once we have the system there, the issue on human rights, on advocacy, on service delivery, on monitoring, on accountability can be implemented. It can be slow. It's slower than just somebody write a law, but it's more sustainable and more resilient. It's much longer lasting. So I would like to see a serious investment in the community system. It have to be the real money. It have to have its own modular. It's not just not the community service delivery. It is a community system. So I cannot stress enough the importance of it, but I am glad to see that there in the GFAN report there's a dedicated section on that, and Mark also speak about the importance of community system, and I hope that this we continue to advocate for this, then we will have a system that lasts and resilient, and the investment will be returned in years after year, and not only for the 3 diseases, but for everything, including human rights, including the social inclusion and societal change and SDG and everything. Once you change people will get organized, things will fall in place. Thank you.
Thank you. I think that's really helpful. And it's really helpful to hear that that part of the, from both of you actually, that that part of the GFAN report and the GFAN ask lands really well in terms of part of the work that we need to do in terms of strengthening community-led and community-based systems for health, so that that's a clear ask from sort of our community. So we have some questions in the chat, or we have one, and I would invite people to put their hands up if they have any questions or discussion points that they wanted to raise. But to start us off, Sergey is asking the question about what some of the pros and cons that you see about the Global Fund's potential to become or serve in some way as a mechanism to channel financing for future pandemic preparedness, I guess, and responses to them, and how that might influence our replenishment efforts. So I think we've taken a position within the GFAN paper that says that there is a role for the Global Fund to play, that in this, and that it is about strengthening community systems and responding to the 3 diseases. And those sort of 2 components together are what will, is effective pandemic preparedness in and of itself, and that there's a role for the Global Fund to play because of the type of mechanism it is. But I'm wondering, Matt or Juan, if you wanted to add any comments to Sergey's question.
I think it's really, I mean, I'll avoid going to taking too strong a position one way or the other, given the debates that are ongoing. But I think one of the things that, at least within the UN systems being actively talked about right now, is how do we think about two things. One, what are the key things we know we need to actually end the pandemics of today, right? That are also pandemic preparedness, right? So to me, things like community systems are spot on as an example of a thing that is, it's not that we need it to fight the pandemics that might come, it's that we needed to fight the pandemics today, and we will be better prepared for the pandemics to come. And so to me, those are the kinds of investments that are incredibly important, where we need to move. And I will secondarily say that I think it is just incumbent on us to make sure that the talk about pandemic preparedness that's happening on the global level does not turn into a situation in which we actually invest billions of dollars into infrastructure that's actually not used and misaligned from the things that are actually saving people's lives today. So in those 2 fronts, I think there's incredibly important work to be done. Thanks.
I can share my view on this. I think I understand Matt's position of not like going yes or no, but if you look at the picture in general, global picture, there's no other mechanism is more ready than the Global Fund to channel funding to the country. The Global Fund is not perfect, and it was not meant to do this. But if you look which mechanism, if you need a mechanism that to channel funding to the country, which one? Which one is better than the Global Fund? We don't see a better mechanism. So it's in terms of channel the funding to the country, but also in terms of the principle and value that attached to it. So the Global Fund is the one, I should not say the most, but one of the most, or the most, the global health program that most protecting of human rights. The Global Fund is the one that really live up to the slogan of leave no one behind and reach the furthest behind first. No other global health program was able to do so. The Global Fund is the one that tackles the discrimination and stigma and being able to overcome that, to bring the people who are most stigmatized and even criminalized into the health system. So that is in terms of reach. And in this pandemic response, we know that we cannot afford to leave anyone behind. So that is, and the Global Fund was prepared and have experience to do that. So both in terms of money, in finance management, in terms of the principle and value, And then there's a system there. They work with the health system, with the lab, with the procurement and supply, with principle of transparency and etc. And have the community system. So the Global Fund is the first one that invests not to our level of satisfaction, is far from that, but still the first one and the only one so far that have some level of seriousness in investment in the community system that help us to work on advocacy and accountability. So when we take the relative, I think there's no one better than the Global Fund. So if we have to choose one, and I agree with Matt that COVID pandemic has not gone away. It's still here. We was hoping that we would end by the end of 2021. It didn't go away. Now we are hoping that it will end of 2022. We are not sure. Now the whole world agree that except for a few countries, now we have to agree that we live with the virus. We don't know what variant we are going to see next month or tomorrow. So it's still here, and I think we need to be prepared to live with it for quite some time. So so that's my thought on the Global Fund and COVID and pandemic preparedness and response.
And can I just throw in one minute of final thought on there? I think that's exactly right. And there's your point earlier, Katie, about governance matters. When we're in the middle of a pandemic and we only consult some governments, we end up creating mechanisms that actually fail to respond effectively to a pandemic. So one of the most important elements of the Global Fund is, in fact, the seats at the table, not just for communities, not just for NGOs, but also for governments from around the world who are actually able to have a say so we don't make big mistakes when moving quickly during a pandemic. Thanks.
I agree. And at the country level as well, with the CCM mechanism, the governance in the country is also very important. And it's helped the response to the 3 diseases have a certain level of success as we've seen so far.
Thank you both. Any good GFAN call always ends on a governance note. So I think we can feel that we've covered a lot of the issues. There was another question in the chat about that we'll have to leave for another day, Peter, but one that I hope that we will continue to have around sort of the modalities and the ways in which we want to see community-led, community-based systems roll out, hopefully with lots more money. And that's what we'll be turning our attention to as this, now that we have this report out, and we talked a little bit about some of the other work that we're going to be doing, but we'll be continuing to build up that momentum and build up that advocacy and the mobilization of people to talk to their governments around the need to replenish the Global Fund, to fully fund it, to end the 3 diseases, to respond to COVID, and to be able to prepare for future pandemics. I just wanted to remind GFANers that we do have a call this Thursday as well. It's a special week, two GFAN calls in 1 week, and we'll be debriefing with the delegations, the communities, and the developing and developed NGO delegations to the Global Fund Board from the most recent board meeting, which was, I think, 2 weeks ago now, but we'll be doing that this Thursday at 8 a.m. Eastern. Juan and Matt, I can't say thank you enough for joining us today, late in the day for you, and for the first time in some time, Matt, but just really helpful to have your thoughts and your perspectives, and really appreciate it, and hope to continue the conversation with you both over the next year. So thank you very much for joining us. And to all the members, I'm sorry, I know we've gone a little bit over. We really should sometimes do these in an hour and a half instead of 1 hour. But just the first of many conversations. So thank you. Keep your questions coming. Let's keep having our discussions. And as Linda said, we'll just, keep our excitement, keep it going, be excited. Let's do this. Let's make this replenishment as successful as we can together. So thank you very much for joining us today. Thanks to everyone, and have a good rest of your days.
Thank you.
Take care.
Thanks.
Thanks, you all.
Thank you.
Bye, everyone.